Thanks, man. Appreciate it. Hey, guys, how are you doing? That's a bit of a weird situation for me right now because I'm a very kinesthetic person and it feels like you're all centered in your earphones. So if you can, give me a little vibe and energy. Are you good? Doing great? Okay. I like that. I need energy. Okay, guys. So first of all, thank you ever so much for Martin and Tina to invite me here to Denmark. Never been before in Copenhagen. I love it. It's a great vibe. I think this convention is very neat, very precise, very stylish. And the vibe I'm getting is that most of you guys are starting on your journey to optimal health. At least that's what I think. And yeah, over this weekend, you most likely learn about the foundations of health. You're all interested in your own journey. I think you want to be just that little kid that inspires people, that is not having any health issues and just living their life. So the foundations, obviously, my journey personally started 20 years ago, almost 21 years ago, when I had my own health issues, early 20s. I crashed with mental health. I'm not going to bore you with the story. I just did too much partying, too much skateboarding, too much drinking, and no one was there to help me. So basically, I'm a dentist, biological dentist, world's leading biological dentist. However, I'm also a health expert, and today I'm the person I would have needed 20 years ago to help me out of this hole, so to speak. So I know how you're feeling when you're just starting, and I know there's this global huge health movement. That's why I'm speaking on all these conventions. And yeah, I feel because of social media and everything, or maybe even you guys, maybe raise your hand if it's their way, you don't really see the forest for the trees at the beginning. You don't know how to start, where to start. Now this guy is talking about dentistry. What is it even on the stage? Yes, I'm a dentist, but I'm a health expert. And I'm still going to drill you today, but not your whole, but with new information. So let's just get started. The foundations of health that all of us need to practice, teach, and preach and live every single day, which is sleep, non-negotiable, nutrition, supplementation, big thing in my teachings for dentists too. Obviously going outside, sunlight, luckily we have sunlight here, not just the light here. Nature, grounding, movement, exercise. You see some biohackers around here walking barefoot, that's grounding. Stress management, community, that's all about community, relationships. That's why I'm missing your energy because of these headphones. It's a very important thing. Brain, mental health, gut, and what is the missing link? Yeah, we learned from Natalie about peptides, very nitty-gritty. Max about nutrition, detoxification, SIM, supplementation. All great speakers here, amazing crowd, and they're all here to guide you. The missing link, in my opinion, is imagine you guys are doing all the foundations that I just mentioned. You're optimizing your sleep, you're using the trackers, you have your diet on point. You may be confused, should I do keto, should I do fasting? Why am I cold in the morning? All these different things. There's so much information. You're going outside in sunlight, you exercise, you do it all, you have the community, but still something feels off. And you have to understand, the epidemic of the 21st century is chronic disease. It's not the pandemics, chronic disease. Little nagging health issues that no doctor seems to solve, which is just actually a signpost of your body that something is off. And if you do all the foundations and there's still something off, let's say brain fog, fatigue, inflammation, lingering symptoms, raise your hands if any one of you guys has something like this. I want to see. Yeah, exactly. And if you ask your family, your parents, your grandparents, you're going to see all the hands go up because that is what we're living in, an epidemic of chronic disease, de-evolution. And biohacking or health optimization basically means living again with nature the way we're designed in an unnatural world. That's why we need to hack anyways. So if you have still some sort of nagging issues, there is a missing link. And maybe you saw that I'm missing a tooth, which is centerpiece to your body, right? The mouth. But I'm sure no one saw that I'm also missing an eyebrow, right? No? That's how important the mouth is. So what I want to bring you more information to the foundations of health is gut health. But gut health is also one part of it. But gut health doesn't start here. Gut health starts in the mouth. The gut is the mouth. It's the entrance. It's the hotel lobby. So it's oftentimes not your genes, it's not more hyperbaric, it's not more spirituality, it's sometimes just foundational work because you had previous dental repair, right? You know what I mean. I've been there. I'm doing this for 20 years. They call me an OG biohacker. I am a biohacker. I just optimize health, and I had to, and I started young, and I'm just there to teach. So trust me, this is the entrance to that tube that starts here, and we just had it with Emil. It ends here at the back door. This is outside body. And if you go to a hotel lobby that looks like this, you're going to see the rest is good. But if you go to a hotel lobby and this is already shitty and messy, I'm sure you're going to leave the hotel, right? But that means if it doesn't look good in your mouth, it usually also doesn't look good in the rest of the body. You understand that concept? Okay, good. I need to know if you understand what I'm saying. So the mouth is, you can see it here. Those are your teeth. Maybe you think about teeth as just tiny, hard biting instruments. That's how we trained as conventional dentists in university. Biting instruments, there's going to be a hole. Who of you guys doesn't like the dentist? Right? Why? Because usually it hurts, it's painful, and they have no solution for you. Just come in once a year or twice a year to find another hole, and it's going to be drilled, filled and built. And we have to change this, because your mouth is an extension of your brain. Your teeth are tiny organs. They have a lymph supply, a blood supply, an autonomic nervous system, and you can see it on this amazing picture. They're directly connected to your brain stem. So it's like your nose, it's like your eyes. Max said it yesterday, the nose is the front door. This is the hotel lobby. Don't know what the eyes are, but it's still part of your brain. And everything we do in your mouth, and you can see here, I'm a specialist in ceramic implants. Everything we put into this system, and this is an ecosystem, it will be transported through that big nerve called retrograde transport directly into your brain. And obviously, your brain is the centerpiece, and the mouth is an extension of it. It changes, it's connected to your immunology, it's connected to your immune system, your nervous system, your autonomic nervous system. It's literally the entrance and all connected. It's pretty clear on this picture. Do we learn this in university as a dentist? No. We learn this, but we're not connecting it. We just learn, hey, there's a hole in your tooth or a dead tooth, and we just learn the fine art, the technical side of things. We're basically a garage system. You can come in and you fix your mouth for biting, and maybe got hijacked by cosmetics. That's it. It's not connected. That's why I'm training dentists globally to become real health experts. I call them real biodentists, but we go there later. So to shock you a little bit, I'm starting with a health check, and I'm asking 3 questions, and whenever the question is a yes, you stand up and you remain standing, right? So any one of you guys has a metal in their mouth. Stand up, remain standing. Could be even a titanium, remain standing. Second question, any of you guys has a root canal in your mouth? Stand up, all remain standing. All of you, don't be ashamed. And the third and final question is, did they remove your wisdom teeth? Okay, stand all up. So, my assumption was that 90+% or 80+% will stand up, and now you can sit down again. I just wanted to make clear that there's room for health optimization. I'm not here to scare you or fearmonger you, but this part that I just asked is the most unnatural part in this house you're living in, which is your body. So you didn't come to this world outside of your mom with a metal in your mouth, root canal, a dead tooth, and remove teeth, right? So this part you cannot optimize and biohack yourself. It's just not possible. But now you know, oh wow, on my journey, I should look into this. I'm not here to fear you, nothing. It's just there for new information to tell you, oh wow, that might be the missing link because I've done all the basics, but the foundational mouthpiece I missed. So conventional dentistry, as I said, focus on mechanics, repairing cosmetics, biting, fixing the pain, the smiles. Drill, fill, and bill is what they call us. Dentists are in medical world, they're not even medical doctors. It's usually you're going to be joked at as like, you're just a dentist. Yeah, don't be fancy, you're not a doctor. But in Germany, it's called Zahnarzt. That means tooth doctor. We're still just dentists, but if we understand the whole bigger picture, and this is what I do for 20 years, is creating systems to optimize all this, we're transitioning, hopefully, if the dentist is open-minded, from the technician to the overall health expert. Because in nature, our body is actually immune against tooth decay, and we wouldn't need a dentist in the first place. Just for you to see now. And this is a nice picture. I don't know if you can see it. It's quite tiny. You can find this on my Instagram. It's called a tooth meridian chart or odontone. Basically, what it shows you is that every single organ here, through that brain nerve, is directly connected with specific organs. So yes, it is possible. And now I can ask you any question. Whatever health issue you have, let's say the missing link to open bracket, thyroid health, skin health, hormone balance, immune system, stress management, is the mouth. Because, for example, you had a root canal on this front tooth, and it's directly connected to your kidney and bladder system, and your hormones are off because of it. There's chronic stress. So understand that every tooth is an organ, and it's connected. It's not just the garage. You get that? Okay, you can follow. You can follow. Okay, cool. Okay, cool. Thank you for giving me a bit of energy here. Yeah, and the mouth-body connection is huge, but it's not taught in universities. So I'm fighting, not a battle, I fought a battle, let's say it this way, because when I started changing this and creating the new concept, that was about 15 years ago, and I'm teaching for more than a decade. I wrote a book it came out in 2019. I had the biggest shitstorms all over the world, all over the place, normal, which is great because at that point they fight you, and every new information is always misinformation, and people don't like to change. And dentists and medicine and doctors, oftentimes not at all, because it's stressful, I get it. But now, basically, they're using the protocols, so it's coming. But it's still pioneer's work, even though I'm doing it for 20 years. It will take more time, but it's my journey, that's the movement, that's the mission. We need to change our profession. Why? Because I want to help all of you guys in the world to get to optimal health. That's just it. And not miss this. Because the mouth, also, being the entrance to the body, has a microbiome, right? We touched on this. It's called the oral microbiome. Everyone talks about microbiome and probiotics and all these things, but we usually talk about the intestine, which is basically down there. Forget the entrance. But it's the second largest but most diversified microbiome in your body. And whatever we have placed there as dentists, unnaturally, will change it. So before you fix this, it doesn't make sense to fix your gut, because the gut starts in the mouth, and you swallow about 140 billion bucks per day, which make up your intestinal gut flora. Emil said that before. So it's a huge ecosystem in the ecosystem. Again, I think the hotel lobby actually makes complete sense, right? The hotel lobby is shitty, all the rooms will be most likely more shitty. And you see tooth decay is #1 chronic health disease. That means our bodies got softer. Why are our teeth not hard as stone anymore? That's the way how they're designed in nature, if we have the right lifestyle. If we go out and ground and sunlight and nature and eat real food, right? Because we got soft. We have processed foods. We don't need to chew anymore. And you see, as a new dentist, the future of our profession, you will see at first glance, oh wow, we have tooth decay, we have holes, body is decaying, your bones are going to be brittle, and you see inflammation. Leaky gum is leaky gut. So you see it in the mouth. If you have bleeding gums, you have bleeding guts, it's normal. And all the other things. And there's more, which he touched on, below gum line, which most people don't even know. So research-wise, there's all the data is there. The problem is just, you don't learn this in university as a dentist. You study a complete medical degree, you learn anatomy, you learn biochemistry, chemistry, physics, but you also have dental school, which means you repair. And this is not connected, unfortunately. And at the end, you're just a dentist who is happy to finish school and can only now focus on repairing. You understand that? And this is how I created all this since 29. So gut issues are directly connected through different things. Gut-brain axis, we know now from research that we find oral pathogens, like porphyronas, inside of the brain causing or contributing to Alzheimer's and Parkinson's because of activation of inflammatory markers in the brain. Porphyronas that's a typical bug you learn in university that is more pathogenic, and it produces some enzymes that can cause inflammation in the brain. You also find these in joints, so rheumatoid arthritis, joint health issues. The immune system is obviously in overload, and maybe you heard of the concept of immune fatigue. So your body imagine your immune system can juggle a lot of things at the same time. We are quite good at compensating. But imagine this, you're going on a walk and you have a backpack and you're loaded up with more and more weights, and at one point it's going to be like super hard to get up that hill. And this is when it spills and you have a chronic health issue. So we have to reverse engineer your whole journey, but start with the foundations. Heart health directly connected, hormonal issues. Again, whatever issue you're facing, it's this one body and not multiple systems, and it's all interconnected, but the mouth is an extension of your brain, so it's in the center. Way more important than your arm. If you have a little rash here on your skin, you're most likely going to see a doctor to get a cream, right? But maybe you have a rash in here you don't even realize, and it's bleeding gums. You still getting it? Okay. Yeah, so for me, chronic disease is this is how we learn medicine in school. The focus is about disease. And in medicine, in dentistry, health is defined as absence of disease. It's on my scale when it comes to optimals, it's a 0. So when you're 0, you're healthy. We're usually in the minus, right, in the negatives. But I'm interested in the 10, 20, 30, level 100. And all these symptoms that you see here, these chronic nagging things that most of our guests have, we don't call them patients, we call them guests. Osteoporosis, heart disease, gastrointestinal problems, thyroid, skin eczema, whatever you want to name, they are connected. And usually you cannot just give one pill, you have to reverse it. And anxiety, even mental health issues are directly connected because the mouth is an extension of your brain. And if you have chronic inflammation in the jawbone, for example, from a dead root canal that you don't feel because it's chronic, these cytokines travel and can change your whole neurotransmitter markup. So you don't feel as good because your body is fighting a fight every single day, which costs energy. And there's lots of studies about it. You just don't learn that in university. So that's why I had to create a new paradigm shift. So basically, why I asked you these 3 questions, this is because we go below gum line or more nitty-gritty. I'm not going to bore you with the detail here, but a few of you have metals in the mouth, a few of you had a root canal, and many of you guys had to remove wisdom teeth. You need to know why this could be a problem, right? So metals in the mouth, dentists, again, they're very good technicians, and they can repair the bite, and they make it look beautiful. But if you go underneath, you will see metal screws. You see, this stuff here is called, wait, it doesn't work. This stuff here is called amalgam fillings. Those fillings are highly toxic. So metals can be very toxic. This is containing 50% of mercury, which is the most toxic non-radioactive element known to man. But for whatever reason, we have to remove it as highly toxic waste as a dentist, but in the mouth it seems to be fine for a patient. Makes no sense, right? But we're brainwashed to think it's good because insurance pays for it. Since 2025, in Europe, it's banned. Finally, took ages. In Scandinavia, it's banned since 2009, so almost 20 years. In Russia, even 30, 40 years. So this one is if you've lost a tooth, a root canal or whatever, they give you a new tooth. And 99.9% of all dentists, surgeons like myself, will give you a titanium implant, which is still the gold standard. But because of our work for the last decade, I'm one of the first ceramic implant specialists worldwide. So I started this 12 years ago, and I've placed more than 5,000 ceramic implants. Only now for 2 years, the medical guideline. But before, it was just, everyone is attacking us, of course. But now, it's there. Again, every new information is going to be misinformation. It's going to take some time. Science is going new ways against the stream. Research is only what we agreed on. And it takes long. And you have to be very stubborn. So whatever metal you have in your mouth, just know, could be a toxin, could be disrupting your immune system, and it could be an antenna in this EMF-loaded world. Again, it's a metal. And you know 3G, 4G, 5G, I always carry a EMF protection in my pockets like over a decade. But if I run around as an antenna, it doesn't really help me. So just know we need to remove metal safely. I'm training real biodentists globally that know all this, but just to get your information. Because now after this talk, you know more than my colleagues. Root canals. This is what we typically take out of a patient. So does this look healthy? Give me a sign. Yes, no? No, right. Because it's essentially a dead organ. And in nature, it was never a good idea to leave something dead in the body because it's decomposing. So we find viruses, parasites, all sorts of nasty things in these dead shells because there's no more immune system, there's no more protection. It's the perfect cave for anaerobic bacteria, viruses, parasites, and it's going to be an immune trigger because your immune system can literally go in there. And the goal is not to now run to any dentist to say, rip out that root canal. That would be very bad. Yeah? No, just know there's a root canal. It costs you a little bit of energy. It's a chronic inflammation in your jawbone. It might be toxic, but we need to have a solution. The solution is what we do is called an immediate ceramic implant because we don't want to just yank out a tooth. Otherwise, you just lose everything. So keep it there for biting. I'll tell you later what we can do and how we train all this, but just know, if you want to optimize your health totally, this is not something you came to Earth with. It's something decomposing, like you have the fish in your bin. It stinks over time. And it's pretty bad. I'm not going to lie. So this I said already, it's never a good idea to leave a dead body part in the body. Is that a good idea, Remy? No. It's a no-brainer, and whatever guest or patient I'm telling this, they're like, of course it's a no-brainer. Tell this to a colleague, because a root canal treatment is a fine art. You have to be a super good technical, skilled person. That's what I'm saying. We have to upgrade from a technician to an overall health expert. And I'm not saying that a root canal is going to kill you. Not at all. I'm just saying, if your goal is optimal health, not absence of disease, you need to see these critically. And then the last question was wisdom teeth removed. This is something you don't learn in university as a dentist. So those ones are chronic silent inflammation in the jawbone. Jawbone should look like this. So after wisdom tooth removal, that wasn't prepared, huge surgery, swelling, non-prepared patient. And then what happens is chronic silent inflammation. Again, perfect case for anaerobic bacteria, parasites, viruses, environmental toxins. Essentially a dead area in your body, directly connected again with your brainstem and the meridian chart. This is small intestine, adrenal glands, heart meridian. So oftentimes the usual suspects for this is chronic fatigue, skin issues, skin eczema, thyroid health issues, hormonal imbalances. Problem is, it's chronic, so your body has switched off volume. You don't hear it anymore, it's not painful. And no one will tell you because that's not dental curriculum. And to find it, you need a three-dimensional x-ray. So you see why it's difficult for me to create systems and then the right dentist that is open-minded to learn all this. Luckily, I have the Institute for Biological Dentistry and I'm training globally and for Biodentistry 3.0. But now you know, wisdom teeth, there might be a chronic inflammation. Why? I had the surgery, it was rough, I was a kid growing up, and no one prepared me with the right nutrition, the right lifestyle, the right micronutrients. Most likely just did it, right? Hands up who just had a surgery, never been prepared systemically, right? That's what we do different. It's so stupid. I mean, every surgeon, why are we thinking? So this is our body, this is our house we're living in, right? We cannot just open a surgery in the construction site and just think the body will just magically heal everything if it's non-prepared. If you're an architect of health, and you build a house, you know exactly you need bricks, you need workers, you need wood. And this is how we do this. We prepare with nutrition, lifestyle, all the health optimization 4 weeks, 6 weeks, 8 weeks prior to even doing this. Why? Because I want you to be anabolic and then heal. Your body needs to be able to heal. Otherwise, it's just stress for your body and the surgery makes no sense and you're going to end up having the same thing again. So, attacking your system. And the roadmap to optimal health. This is maybe a good slide for you to design because this is why I'm speaking on all these events, from medical doctors to health events, is giving you a timeline or giving you a roadmap because there's this overload of information. And if you go to open social media and Instagram, you're going to see a new snippet of health and whatever you shouldn't do. Usually the algorithm works with avoid these things and it's going to be pretty bad. I'm a fun person. I want to live and enjoy this life with a great community, teaching, preaching, and having fun. That's it. Like a little kid. I don't want to hear, I can't do this, I can't do this, I can't do that, and I just want to know and navigate. I just want to have the tools. So yes, foundation entrance might be this congress today or this event. Now you're there, now you have the moral obligation to change if you want. Optimize the basics, the sleep, the nutrition, the movement, sunlight, nature, all these things that you see on the left. Do this. Those are the foundations, but you see here, gut health, oral health is foundational. So as long as you miss main train station here at one point, it should be early in your health optimization journey. Why? Because if you still have the source in here, you can't deal with stress. You maybe don't sleep good. Maybe you're using nutrition and supplements to compensate for the stress. Why? Because they are chronic inflammation. This is the main stress on your body. It changes your posture. So if you want to work on brain health and you have all the foundations, you're still not feeling good, keep this in mind. Oral health optimization is the missing link. And then usually, after all this is set back to normal and your body is healthy the way how you came out of your mom, then usually it's going to be time to do more crazy things. Then maybe it's a good idea to invest in hyperbaric. Maybe it's a good idea to do some IVs. For most of our guests, if they do all this and the whole journey, it starts 4 weeks prior or 8 weeks prior, they optimize their nutrition, the foundations. Then they come in for 6 to 10 days to optimize the mouth once and for all. Then they know exactly for the next 4 to 6 months when everything heals what to do. So they have the perfect guidance. And they come back usually 10 kilos lighter, complete different energy, no more migraines. And for 80% of our guests, when they get their final teeth on top, phase 2, they're good. they're healthy again, they're back to normal, they learned a lot, and they know what to do for next. There are 20% that need more, like myself. I needed everything. I wanted to learn spirituality, I wanted to learn psycho-emotional trauma, yes. But it's easier when this vessel is clean, then you can everything is just easier, you understand? And I see oftentimes people prescribe, go IV treatments, do hyperbaric sessions, invest 20,000 euros in this. Why? Just to compensate for this part that no one touches. So that's a little bit of a, you understand that? So it's a timeline. When to do what? Because the biggest detox is going to be removing the source. And you see here, if you look at a panoramic X-ray, that's a ceramic implant. So root canal, root canal, root canal, root canal, biocompatible material. And this is the stuff we're taking out. How are you going to ever detox your body if this is in your mouth? You might be pirates, if you're Pirate of the Caribbean or Terminator, this works. But this, you can never detox with any IV, not possible. So invest in this part, and then you have the most bang for your buck. And this is my interest. When you invest in the journey to optimal health, I want to give you a 10x return, which a 10x, which means the dividend is going to be optimal health. And you know, and you learn a ton. I mean, you learn through osmosis of the stuff that I learned for 20 years extremely. Yeah, so that's Biodentistry 3.0. Biological dentistry, holistic dentistry. If I tell you to see one of these, it makes no sense because these terms are marketing terms. They mean nothing. No trademark, no standard. I've trailblazed this movement for over a decade. So my responsibility is to give you good guidance and say, okay, these people are certified, they're doing it all. So we set a perfect medical standard where we all include this. Everyone that calls themselves a real biodentist, that is my community, there's a directory on Instagram, does Biological Dentistry 3.0 in a certain level. There is level 5 flagship what we do, but there's levels to it. So these dentists speak the same language like me. They're health experts, maybe in training, but I'll make sure they know all these things. We're melting high-tech dentistry, and biological dentistry maybe mostly means using biomaterials, but we're melting it with functional medicine, with health optimization, with everything you learn here. Have that on site in my clinic in Tübingen, Germany, and yeah, just be there to guide. So this is what I'm building. It's a true global standard for biological dentistry called the BGS, Biodentistry Global Standard. Because I kind of have to control the information and what's coming out and the systems and the protocols. Why? Just for you guys. Just that when you're a guest on this journey, you will know you go see a BGS clinic or a certified real biodentist, they're going to help me. And they're going to be co-elevating, meaning if the dentist doesn't know something or is not good at the surgery, he's going to bring them to me. So it's a co-elevation, non-competitive system. All dentists and medical doctors are unfortunately, oftentimes very competitive in a scarcity mind. I do co-elevation. I want to bring and help everyone grow. And this is why this is openly communicated and why I pick every single real biodentist myself. They have to apply for it, like my guests, they have to apply. But I think this is the way we can create the Biodentistry Global Standard. It's there, it's global, so I'm teaching globally. It's not just in Europe, but it's still too tiny. So I will leave you the last 2 minutes because this was like nitty-gritty, but you could follow, right? So now what can you do tomorrow, right? Become your architect. Of course, number one thing for oral health, and you want to know about hygiene because normally a dentist tells you about brushing, right? I didn't yet. So all these things that you see in a conventional supermarket is toxin toothpaste. Just toss it in the bin. All biodentists go toxin-free, no fluoride, no SLS, no triclosan, no chemicals. Why would you nuke your oral microbiome on a daily basis? Max had it yesterday, who saw it, yeah? So all these antiseptic mouthwashes, they're essentially destroying your microbiome. And instead of this stuff, this copy-paste in every supermarket, I'm sure it's the same brands in Denmark, 100%. You have to learn about the nutrition. Get enough protein, eat real food, get vitamin D3, vitamin K2, magnesium, zinc, omega-3 fatty acids, the basics. Because then your body is able to heal itself. Unfortunately, if you had previous dental repair, we need a little bit more. But I've also designed, I have a supplement company for over a decade and created protocols here. But in essence, it's all there to make sure your body is in an anabolic means, it's in a mode of growth. It can build tissue and teeth, and they stay hard as stone. And you're never going to see a dentist in the future again, right? Because you understand the basics. So reclaim your health, super simple, toss that toxic stuff, get a toxin-free toothpaste. Spoiler alert, I also have one created because it was the most asked question in the last 5 years was, which toothpaste do you recommend? None so far. Get up-to-date panoramic X-ray. Yeah, because it's all toxins. And if a toothpaste you need to eat, it needs to be edible. And then obviously, once you have the oral health care, which you can see here, you can see good toothpaste, brush with a soft brush. Coconut oil pulling is for free, basically. Most of you have a coconut oil. It could even be olive oil. Copper tongue scraper would be a good investment to scrape your tongue and then support with the right micronutrients, go outside in sun and ground. And then maybe on your journey, remember, I need to find a real biodentist that does Biodentistry 3.0, because then you're going to have the right help, only there. And of course, over time, no more metals, no root canals, no cavitations, but this is obviously needs to be planned in your journey, and I hope I didn't distract you. And yeah, you can scan this, and this is a launch offer just for you guys. My toothpaste came out, more than a toothpaste, a year ago in Europe, and it is designed for me and my kids. I have 4 kids, 11, 8, 5, and 2, and they eat that stuff. I did it too. I don't want to have my kids eat fluoride and toxins. If they eat this, and there's hydroxyapatite and xylitol and coconut oil, and it brushes too, and there's probiotics in there, then I'm good with it. So use whatever you like. This is there. Scan it if you want. And then start your journey. And if you want to learn more or follow, this is my Instagram handle. And the mission is to change dentistry and medicine completely globally. And this is what I'm never going to stop. So thank you for listening in. Tell me one more time, was this okay for you? I need to... Woo! Yeah, exactly. Nice, guys.
Thank you so